Senator Roy Blunt with us this afternoon. How are you, Senator?
Hey, Mark, I'm good. How are you?
Good. All right, so this thing has kind of blown up quite a bit in the past few weeks. I have several questions, but let's first talk about what your amendment is and what you're trying to accomplish here.
Well, I have answers to your questions, so I look forward to getting a chance to talk about this. You know, this is the Respect for the Rights of Conscience Act. It's a bill that Senator Nelson from Nebraska and I, along with Marco Rubio from Florida and Kelly Ayotte from New Hampshire, filed last August, months ago. But what really suddenly brought attention to the effort we've been trying to make now since last summer was the White House deciding that they could tell faith-based organizations what they had to do regarding health care. And it's only one of many things that you could do. So our bill doesn't mention any specific faith or any specific procedure. It just restores the traditional First Amendment rights of religious freedom and rights of conscience, and says that people can't be required to do things that they have a moral conviction and a religious right of conscience reason not to do. And it's well ingrained in all the other laws we have. It's just that we've never had health care mandates from the federal level before, so we've never had to have an exclusion in the health care area.
Your colleague, Senator Barbara Boxer, says this: it would allow anyone to deny any health care service for any reason. If I believe that prayer should cure all disease, that's my belief, and if I'm an employer, I can deny coverage for any life-saving intervention. True or false?
False. And actually, it wouldn't give anybody any rights that they haven't had for 220 years. No employer gets any new rights under this bill. It just goes back to the Bill of Rights and says you still have those rights, but at the same time, while the government now would have the capacity to mandate that employers do certain things in health care, you'd have to be able to prove in a court, if necessary, that this really was a religious, faith-based moral conviction that was in violation of your faith beliefs, whether that's Christian Science or Catholics, whether it's Methodist or Muslims. Every religion's treated the same as the First Amendment treats every religion the same.
What was wrong, in your view, and I tend to agree with you here, on the president's so-called compromise on this issue?
Well, the compromise is a symptom of the problem. It's not necessarily the problem, or is it the only problem? You know, we don't mention contraception. We don't mention sterilization. We don't mention whether or not you can get a blood transfusion if you're in the Christian Science faith or not. We don't mention any of that. But if you want to look at this from the point of view of the institutions impacted, they don't believe these are the right things to do. So it really doesn't. The president acts like this is a financial consideration only, that, well, if somehow the insurance company is mysteriously going to pay the bill, and by the way, I think that's largely an accounting gimmick and nothing more than that. If somehow the insurance company is going to pay the bill, you should no longer be offended that you're a party to that action. Now, this should not be about cost. It should be about faith and the Constitution, and you should be just as offended if the insurance company is paying a bill for something you don't believe in and you've facilitated that as you should if you're paying the bill. This is not about who pays the bill. It's about what your institution believes and the faith principles you reflect.
Well, I agree with that, but I also wonder, why isn't there more focus on the aspect of this that forces insurance companies to, without a copay, provide contraception? My point on this last week is, look, there's a lot of people that have, and the White House positions this, Senator, as access. I don't think forcing without copays is about access. That's forcing someone to do something without copays. But I think a lot of our listeners, male or female, have other medications that they may love to have provided to them by their insurance companies without copays.
Well, that's a good point. And remember, if you want to get this down to the narrow impact of this one mandate, this is about people who have a job. They work for a faith-based institution. Generally, the concern in this particular rule has come from Catholic schools and Catholic hospitals and Catholic daycare centers and Catholic employers. They work for these employers, and these employers are in almost virtually all cases giving them insurance. It just doesn't happen to include specific things that are otherwise available, by the way, that the employer doesn't believe are the right thing to do. And the employer, if the faith-based institution, Mark, doesn't reflect the distinctives of who they are, then it's just another hospital that has a chaplain, or it's just another college that has a theology department. It's no different from any other school or any other hospital. And, of course, that's not the case with Christian schools or universities or hospitals of various kinds, Jewish, Christian, otherwise. They have to be distinctively who they are and reflect that, or there's really no longer any reason for them to hold themselves forward as a institution that's reflective of their faith.
Senator Roy Blunt with me this afternoon. One other question on this topic here. You're trying to attach this to a highway bill. Why go that route?
It's the only bill that's up right now. Okay. My long-term goal is to get this on a bill the president has to sign, and he said he would sign the highway bill. But if this president won't sign it, I'm hoping we're going to have a president a year from now who would sign a bill. The laws are full of these exceptions right now for hiring, even for health care in the past. There have always been all kinds of exceptions using exactly this same language. And Barbara Boxer and others have voted for bill after bill that had this same language if they did something like said you didn't have to participate in a carrying out of a capital punishment execution if your moral conviction or your conscience issue of conscience made it impossible for you to do. They were glad to vote for that, or they were glad to vote for you can't force people to have a vaccination if it violates their faith principles or the very language that we use in our bill. This is not a new concept. It's only being applied for the first time to real health care mandates because until the president's health care bill, the federal government had never held forth that it could make people do specific things regarding their health care or their insurance for health care.
One other topic I just wanted to touch base quickly on, payroll tax cut extension. Looks like it's going to happen. Your thoughts on that?
Well, it does look like it's going to happen. I guess you and I have talked about this before. I'm sort of an outlier on this issue. I really think people not paying money into the Social Security system weakens the Social Security system. And I'll look at the final bill when the House is finally done with it. But up until now, I've generally been opposed to the Democrat plans and the Republican plans that extended this for another year. Why would you want to weaken Social Security? It's got enough challenges without turning the revenue stream into borrowed money from foreigners instead of a contribution made by workers who then benefit from that system.
I don't understand that either, and that's that's frustrating that there's not more focus on that. But of course, you understand politics. There are political risks to saying no, we're not going to pass this, and then everybody, and it would be a nightmare for accounting offices across the country to say we got to tack this on 2% this year, right?
Well, the problem will be next year now. I think this is probably going to happen this year because most people have decided for political reasons or otherwise they just don't want to have this debate right now. But I remember when I was in the House as one of the leaders, we would constantly have people come and say, gasoline prices have just gone up. We need to have a gasoline tax holiday. And every time that happened, I said, well, now exactly when do you think we'd put that gasoline tax back on? And if we don't have that, how are the roads maintained? And this is the same principle. This is a dedicated tax that the people who haven't paid into Social Security couldn't benefit from Social Security, or their family couldn't benefit from the insurance elements of it. Now, for the first time ever, we're saying, well, Social Security is just kind of like some other program, and we're going to borrow money here and put in general revenue there, and we're not going to worry any longer that the contributions from Social Security don't pay the bill.
Senator, great to have you back on.
Hey, great to be with you, Mark. Look forward to seeing you soon in St. Louis, and thanks for what you do every day.
All right, come see us soon, and we'll talk soon. Thank you.